The Oregon Health Authority just released vaccination rates among healthcare workers across the state. It's the most complete look we've gotten so far at this industry. The OHA data shows about 70% of healthcare workers are vaccinated. That's about 5% higher than Oregon's general population. But according to the data, rates vary widely by license, age, and county. When you break down the vaccination rate by license type, 94% of Oregon dentists are vaccinated. Medical doctors are about 87% vaccinated. On the other end, only 50% of chiropractors are vaccinated. Out of the almost 13,000 certified nursing assistants, 43% are unvaccinated. When it comes to EMS workers, paramedics are the most vaccinated at 64%, while emergency medical responders and technicians are just below 60%. Dr. Dana Hargunani is the Chief Medical Officer for the Oregon Health Authority.
So how does it concern you when you do see some of these healthcare workers, continuing to not get the shot?
I think overall we see optimism in some of the very high rates of vaccine uptake among some of our healthcare workers. We know we still have work to do, so we will continue to keep working to make sure all barriers are reduced and that we can move this vaccination rate upward.
According to the numbers, vaccination rates vary widely depending on where you are in the state. In the metro area, Washington County is at the top, where 82% of healthcare workers are vaccinated. In eastern Oregon, the numbers are much lower. Only 43% of healthcare workers in Harney County are vaccinated, the lowest in the state.
We are in a global pandemic.
Becky Holtberg is the president and CEO of the Oregon Association of Hospitals and Health Systems. She said current state law prohibits hospitals and other healthcare providers from mandating vaccines. The OAHHS does not want a statewide mandate to vaccinate healthcare workers, but they do believe each hospital system should decide if they want to require their workers to get the shot.
If the state would change this law or create a new rule, we know that each community is different and each hospital is different. Some hospitals may choose to mandate vaccination, others would not. But it is important that the hospital and the local community have the ability to make that decision. That's what this is really about, is making sure that hospitals have tools to respond to the local circumstances in managing the pandemic and in keeping their patients safe.
I'm Cristin Severance, KGW News.